Got some familiar names in our participants. See, Brooke from the USC lab team is here, as well as Trisha Moats and Darian. Welcome, y'all. Always nice to have friendly faces or friendly ears and eyes on our webinar. Okay, so it is 4 o'clock. So on behalf of the Southeastern School Behavioral Health Community and the Behavioral Alliance of South Carolina, I want to welcome y'all to this month's webinar. We are incredibly excited to have with us today Dr. Aldridge, and he has a fantastic game plan for our webinar. It's going to be incredibly interactive, so please stay engaged. Please be participatory. We are going to have chats. We're going to be utilizing our poll feature as well as the Jamboard. So if any of y'all are unfamiliar with the Jamboard, feel free to send me a question in the Q&A, and I'm happy to walk you through that. We will use that at the end for some responses. And I want to let y'all know that Dr. Aldridge kindly built in for us a question and answer period at the end, but we would love for you to type your questions in the chat as we're going. I will monitor that, and then we'll field those at the end. For the wonderful humans that are joining us on Facebook Live, hi and welcome. If you have any questions, please put those in the comment box below the live, and I will make sure that Dr. Aldridge gets those at the end of our conversation. And we did want to also give a nod to the fact that the Southeastern School Behavioral Health Conference, hybrid conference this year, is coming up on April 15th and 16th. So you still have time to register. Please join us virtually or live in person. We are very excited for this incredible event, and we hope to see all of y'all there. So if you will take a moment of your time, I'm going to go ahead and populate a brief pre-survey. This will take just a moment, and then I will joyfully turn it over to Dr. Aldridge, who undoubtedly will wow and amaze you with his content for today. So we're going to go ahead and launch that polling. And then Dr. Aldridge, if you'd like to go ahead and start sharing your screen while folks are completing that poll, then we can go ahead and get started, and I will give you that prompt. Well, we've got a great group with us today. Dr. Aldridge, looks like we've got some policymakers, professors, some students, mental health professionals. It's always wonderful for us to have that diversity in our community and population. Okay, give it just a little bit more time for y'all to finish up here. Predominantly mental health professionals today, which is really interesting. We're really grateful to have y'all with us. And just so everybody knows, the slides as well as the recording will be available on the School Behavioral Health BASC website at www.schoolbehavioralhealth.org/BASC, and I will put that in the chat. All right, so I'm going to go ahead and end that poll. Please be mindful that we do have a post survey at the end, so stick around with us, as I imagine y'all intended to. So with that being said, thank you again and welcome, Dr. Aldridge. We're so grateful to have you, and we're excited to see what you have for us today.
Great, Taylor, thank you so much. And hello to everybody. Good afternoon. Hope everybody is doing well and enjoying the last part of your days, if you're, I assume, many on the East Coast or wherever you may be, whatever part of the day it is. I'm Will Aldridge. I am a Senior Implementation Specialist and Director of the Impact Center at Frank Porter Graham Child Development Institute, UNC. I am excited to be with you all today in the Behavioral Alliance of South Carolina Network to share a little bit about our approach and our work to improve the use of evidence-based practices. We do a lot of work in community settings and school settings, and want to talk and frame a little bit about the implementation science approach and even some practice strategies and ways that looks on the ground. So before we get started, I'll show you my agenda, but I want everybody to get out their chat. Type in the chat 2 words, just 2. You can't have more than 2, but 2 words that come to your mind when you hear the term implementation science. So take out your chat, reply to everyone. And I'm going to talk through the agenda for our time today in the next slide. But we'll have Taylor actually, after I go through that agenda, share a little bit about what you all are saying. It can be anything you want to say. It can be, holy cow, or it can be, don't know, I'm scared. Whatever you may have is welcome game. So looking forward to hearing some themes. So while you're doing that, let me walk through what I'm going to take you through. First off is the recognition that implementation is hard, isn't it? And I don't necessarily mean that as a question. I mean that as an act of sympathy, that this is really hard work, and a little bit about that. Then I'll take you through an integrated theory of change for maybe a different way to look at this effort in this work, to make it happen. I want to briefly just touch on a relatively recent consensus study report that was put out by the National Academies of Science, Engineering, and Mathematics that may be of interest to many of you here, and knowing about and where you can follow up and read more. And then we're going to try our hand, little risk taking here on my part with the Jamboard to see what your takeaways and action steps might be moving on from this webinar. So Taylor, I'm curious, what are you seeing in the chat?
Well, I definitely see a lot of participation, which is incredible. So we've got great approach, evidence-based, intentional design, lasting change. That's a very powerful contribution. Startup and frameworks, evidence and design, and evidence-based practices.
Excellent, excellent. Those are all wonderful reflections and statements. It's really interesting to see, folks' cognitive framework when they think about this. I particularly like the one intentional design. That's going to perhaps come up a little bit as we walk through some of these slides. But thanks for all of that. Well, let's kind of get around the table here and hopefully commiserate a bit, because implementation is hard, isn't it? What I want to do is start with a poll here that Taylor's going to put up. I'm going to go through 3 of these. This is a little exercise for us all. I'm going to give you a slide with a couple of choices with outcome results. And Taylor will put up the poll, and I want you to answer, based on the information you're seeing, which program that you see of the 2 on the next slides do you want, if it was your family member, your child, your sibling, your parents, whatever it might be, which would you want to send your family to? So here's the first example. This is an employment program for adult mental health. These are all, by the way, real data from published articles. The results of this program are employment. So for program A, the individuals that went through program A, about, let's say 42% were employed after the program. Program B, a little over 90% were employed at the end of the program. So Taylor's going to put up the poll, and I just want you to select, we're not going to leave it up very long at all. Which program would you want for your family? Program A or program B?
All right, so we've got a few folks coming in. We're at about 10 seconds. We'll give y'all a few more. Looks like overwhelmingly so far, Dr. Aldridge, we've got program B.
All right, sounds good. Well, we got a couple more, so we'll go ahead and close it. If you didn't get a chance to vote this one, you got to have fast fingers today, folks, when we do the next one. So overwhelming support for program B. Let's take a look at the next one. This is an adult substance abuse treatment program. The result here are percent clean urine screens. So after the program, if you went through program A, it's just under 30, let's call it 29% clean urine screens, are having clean urine screens. And then program B, it's a little over 80%. So Taylor's going to pop that poll back up now. Again, for your family member, if they were going through a program, which would you prefer, program A or program B?
We got folks jumping on it this time. I think they know that we've got a bit of a quick draw McGraw going here. Okay, again, we've got overwhelmingly program B.
Okay, program B. Thanks so much. I'm seeing a trend here. Well, let's see. Let's try this one. Here's one that may be really relevant for this community: school behavioral health. All right. So your students, your children, program A, if they are involved in this in their schools, it's about a 20% reduction in aggression in the school environment. Program B is somewhere around 55, 56% reduction in aggression. Which would you want for your children, your students? Go ahead and put in your votes.
All right, 5, 6, 7. Let's see here. I'm seeing a similar trend here, Dr. Aldridge. We again have program B.
All right, program B. Thanks to everybody for voting. Thank you, Taylor, for the polls. So it wasn't a trick question, but there was something tricky here. Maybe it was a trick question, honestly. And each chart that I just put up, and remember, these are reflective of real data, A and B are actually the same program and the same implementation effort. Program A was actually a reflection of low fidelity implementation of that program or practice. Program B was the high fidelity implementation of that same program or practice. And you can see the actual evidence-based programs that these reflect: supported employment for the adult mental health program, dialectical behavior therapy, a well-known therapeutic practice that has been applied to substance abuse treatment, and the PATHS program, or promoting alternative thinking strategies for the school behavioral health program. Now, by fidelity, what we mean simply, it's not reading from the manual, it's really thinking about the core active ingredients of that program, the things that, if removed, would make us less certain that we would be able to achieve outcomes. Let's look at a little bit more data. This is real data from a rollout of functional family therapy in Washington State. As we look at this distribution, what you may see in the top here, there are 12 on the left, there are 12 therapists. And what you see in the horizontal bar charts are the percent of their caseloads that are going back into I believe this is juvenile justice data. So they are re-entering the system. There's recidivism, okay? The percent of their caseload. And same thing for therapists 13 through 25. But the reason that there's this line in this cut is therapists 1 through 12 were above fidelity criteria. They were meeting fidelity benchmarks, okay? And overall, the mean for that subgroup was about 13% recidivism. Those therapists who were not consistently meeting fidelity criteria, therapists 13 through 25, the mean was about 28% recidivism. And as you can see, the control group in this real world example, it was about 22% recidivism. So here's an example of a well-supported, evidence-based treatment that, depending on how it was delivered, how it was implemented, it really depended on whether or not the recipients were going to experience the benefits, even whether or not they were going to have more beneficial outcomes than the control group. And then lastly, here's a good, I think, well-known now meta-analysis that looked at comprehensive school reforms. And this work, really took a look at what happened over the course of the rollout over 5 years. These 4 comprehensive school reforms that were analyzed in this meta-analysis showed that, in the research, when they were demonstrated to be effective and well-supported, every teacher was trained in those methods and every teacher was receiving continual support. But when they were rolled out in years 1 through 3, fewer than 50% of teachers in the schools that were implementing actually received some training. Fewer than 25% of those teachers received ongoing support in years 1 through 3. And in years 4 and 5, they found that fewer than 10% of the schools were using the comprehensive school reforms as intended. And therefore, it was very likely that the vast majority of students were not benefiting from the types of outcomes that these reforms demonstrated in the research trials. And this was a federal effort that was rolled out over 8,000 schools to the tune of $2 billion. So there is real cost to ineffective implementation. And when we look at that, what we tend to find is that our traditional methods of implementation, the ways that we often try to get new programs out there, don't typically work. They're not sufficient in and of themselves. This could be publication in journals, or even just having training manuals, training materials, and offering training, that alone. Passing laws or mandates or regulations that really requires systems or implementing sites to do certain things or to achieve certain benchmarks. Providing funding or financial incentives alone, funny enough, has not been shown to really move the dial. And organization change incentives, these big kickoffs that we're going to do business a different way, and there's a lot of energy that gets going behind it. And then it tends to drift back to old habits. Overall, when you look across the literature, these types of methods alone typically result in 5 to 15% adoption and implementation and benefits. They are necessary, but alone they're not sufficient. Why is this? Why might this be? These are some of our favorite quotes about service systems. That is where the work of implementation is done. All organizations are designed intentionally or unwittingly to achieve precisely the results they get. When we think about that, of course, I don't know about you, but it makes me think, well, if we want different results, we need to change the system. It's not just about the program or the practice. The second one, the reality is that any social system is the way it is because people in that system want it that way. There's vested stakeholders and interests. And a very simple short quote from the former CEO of the Annie E. Casey Foundation, Patrick McCarthy: systems trump programs. That is, you put any innovative program or practice in a system, and over time, that the inertia and the normal gravity of that system is just going to eat it up. It's going to chew it up. So essentially, what we are often have been doing through these typical methods is we might have a site where we want to implement something, could be a school building. We have a program purveyor bringing training and materials, and likely a funder that's paying for this. And then somewhere down the line, we've expected student outcomes or child and family outcomes. But oftentimes we've been really unclear, well, how do we get from here to there? And it's quite a journey, and it's a complicated journey. That's why this has been so hard. It's hard to do system change. And, I'm not sure, nobody that I heard when we kind of went through your 2-word chat response put in there system change. But implementation and scaling is work that involves organization and system change, not just work on the program. So let's talk about how we make that happen. This is one of my favorite quotes that comes from Hendrix Brown, who's a well-known implementation researcher at Northwestern. We were interviewing him for a report. And, we were talking about what is the field that implementation science is like? Is it a social service? Is it more like social work, psychology, education? And he said, really, the work of implementation science is much more like engineering than it is some of these other disciplines we tend to draw from, because we're given a challenge, some pieces, some parts, some tools, and maybe a team. And we have to figure out, how do you build a boat to get across the river? And he said, implementation is really not about discovering whether things could work, but it's about making things work. And that's a really different lens, I think, than a lot of folks have taken in the work of trying to implement or scale a program or practice. More often it's been, it should work, or it will work, and we'll find out when we get there, rather than thinking, how do we really make this work in our system? And that's why I really love this definition from our colleagues who are with the SSBHC Center. Many of you may know the SSBHC Center. It's actually here at FPG at UNC Chapel Hill, and they focus on state education systems and scaling evidence-based practices. The definition they use for implementation is a process. And we'll almost stop right there. It's a process. It's not an event. It's not something that happens overnight. A process involving multiple decisions, actions, and my favorite part of this, corrections, to change the structures and conditions necessary to implement and sustain, right? So changing structures and conditions, but corrections implies we're going to get it wrong. And we need to know when we're getting it right and when we're getting it wrong, so we can do these iterative decision-making processes and take new strategic actions. Okay, well, that's good if that's implementation, but here's another challenge. I'm going to ask you to get your chat back up again, because implementation science has started to really bloom and blossom and mushroom. So I'm going to ask you, first off, models. How many models, that means frameworks or theories, how many do you think there now are that are recognized in implementation science in the field? So take out your chat, enter your best guess. 10, is it 100? How many models, theories, frameworks now, and this is actually of 2012, so it's been a while, but how many are there recognized in implementation science? Take your best guess, pop it into chat. I'll have Taylor help me out when we get some things rolling in. Maybe even just take the first few that roll in. I blew it. I hit the trigger too quick. What did you see there, Taylor, before I revealed the answer?
Well, we've got, folks certainly jumped on it. So we've got 20, dozens, question mark, 50s. So a lot, I think, is where folks were going. And some folks, Jacqueline, looked like they were pretty close.
Excellent. I'm surprised after I revealed it a little early, somebody didn't type in 61 exclamation point.
Got 28.
But there's a lot, right? There's a ton. All right, we'll give you a fair chance this time. I'm not going to reveal it. Let's talk about implementation strategies. These are things you can do that are recognized, strategies that you can take that help with an implementation effort. Think about it as the periodic table of elements. How many strategies do you think are now recognized that can contribute to successful implementation? Go back to your chat, enter a number. What's your best guess? How many strategies are there? And Taylor, list a few as they start rolling in.
All right, we've got 7, 170, 11d6, which is now my favorite answer. It's definitely got to be 11d6. 5, got a pretty wide range here, hundreds from Kristen Douglas.
All right. Well, you're getting the idea. You're picking up. It's a lot. 73 as of kind of this 2015 work by gathering a bunch of stakeholders and experts and putting it together. The take-home point here is that if you're going to go down this road using an implementation science approach, you almost get paralyzed because there's so many options, models, theories, frameworks, and strategies to choose from and to navigate as you think about how to make this work in your specific context. So what I want to take you through now is maybe a different way of thinking about it, a theory of change. for what this work can look like no matter where you are, and trying to drive the outcome. So you may remember we started kind of with this black box, and we're trying to unpack, well, what goes in the middle here? So I want to walk you through the various pieces of how we think about this in terms of capacity and performance, and then not just your overall outcomes or even your program outcomes, but thinking about implementation outcomes. Let's start with co-creation support. So you may remember in that first black box example, we had these players, if you will. We had your implementing site, which might be your leadership and staff at the site. You have funders, but we're also going to include policymakers here. So for folks that said you're in a policy role, hopefully your ears will perk up. And then your purveyors that are bringing training and materials for a particular practice. But there's more. Intermediary partners. These are folks who may provide support to you around a variety of implementation challenges for a variety of programs or practices. Community members and partners. If you're in school systems, this includes your students and their family members as well. And then the original intervention developers and folks that are ongoing in their research role. And here I want to call particular attention to the opportunity to pay intentional attention to equity and inclusion. Now, you may remember earlier talking about implementation being a process of system change and organization change. And you may remember these quotes, right? And when we apply this idea of equity and inclusion, and we reread these quotes, it begins to make us think in a different way, right? Any social system is that way because people in the system want it that way. They're designed to get the results they get, okay? Well, when we put all this together and we begin applying an equity lens and an inclusion lens to our implementation and scaling efforts, we come to this recognition. You know, many of our community institutions and service systems are producing disparities related to race, sexual orientation, gender, ability, and other factors. And if we're going to embark on implementation and scaling, which includes necessary adjustments and changes to systems and to organizations, we need to be doing our own work to partner, to identify, partner, address, and resolve these outcome disparities as a part of change, as a part of program implementation. And that if we don't have that lens and attend to that responsibility, we could perpetuate, or in some cases, even increase disparities and inequities in their root causes. So what might that look like? What's a simple framework? Well, with this co-creation lens, with this variety of partners around the table, we can look at our outcome data, we can disaggregate it, we can look at how different outcomes may be experienced by different communities according to race or some of these other cultural factors and social factors. We can then involve those community members, those who have been discriminated against or historically marginalized, to identify the root causes for some of those inequities. And then involve those partners in a co-design process around program and implementation strategies, and then fully include them in actually using or putting those strategies into place. And of course, maintaining and sustaining their partnership, their engagement, to monitor and improve those outcomes, and therefore reduce disparities and inequities over time. So if we take just a moment to think through that co-creation process, there is a real ability and opportunity to do some of this needed equity and inclusion work while we are implementing and scaling new or evidence-based programs and practices. Okay, so we've talked about co-creation. What about this next part of the puzzle? Capacity and performance. And you may be saying, Will, I kind of understand what capacity and performance are, but why in the world are there water faucets above this part of the theory of change? Well, we can kind of think of capacity as like the pipes and performance is the water flowing through the pipes, okay? So we've got examples, and these are some images that show you can have one without the other, right? So this image would demonstrate a whole lot of performance, but absolutely no capacity. So water just kind of goes everywhere or nowhere, as the case may be. And over time, it just kind of, evaporates or, goes into the ground. It doesn't get where it needs to go. We can have a little bit of capacity, we can have a little bit of performance, and we get a little something. I like this photo because I also think that the aim or the target for this isn't going to really work for a lot of people. And so it just sends it into one area and perhaps down the drain. This is what a lot of our public systems experience and our nonprofit systems experience, which is a huge push of performance, and the capacity feels like it's barely holding on. It's leaking at the seams. But what we're after for good implementation and scaling is really nice, strong pipes and really good water flow that's directed to get the benefits of these programs and practices to the right place, so that our students, so that our families, our children, our communities can equitably benefit from them. And when we think about what capacity and performance is for implementation, we've got 4 different areas to kind of take a look at. Leadership and implementation teams. And what is their performance? It's not rocket science. It's leading implementation and scaling and supporting it along the way. Our workforce development systems, which really are designed to develop competent and confident practitioners, or in some cases in schools, this would be our teachers, our mental and behavioral health counselors in schools. We have quality and outcome monitoring systems, and there's a couple of performance angles here that aren't always done together. Gathering, analyzing, and reporting data, usually there's a lot of that going on, oftentimes because systems have to, but the system-wide learning and improvement process, right? Remember, with implementation, we're going to make mistakes, and we need to know so we can make corrections and have multiple opportunities for decision-making and action. And lastly, media and networking systems. And this is really about kind of like public health communications, even if you're not working in public health. The idea here is, how can we mobilize knowledge and behavior change beyond just practitioner or teacher interaction with a student or with a family or with a child, right? And as an example of that, particularly for school networks, I love bringing in this example. This was a media report from NBC Washington in 2017 that talked about students organizing for Mental Health Week at a Maryland high school. And here you're really looking at communications, media, messaging, and the use of existing communication networks in schools to influence, shape, and change the conversation. So a lot of times we're not necessarily looking for widespread ability to change behavior, but we might be working to shift attitudes, readiness, preparation, awareness, confidence, and even create norms where it's okay to seek support for a variety of targets that we might be trying to get at. Okay, so we've got pipes, we've got water flowing through it, but let's talk about implementation outcomes and outcome monitoring. Everybody loves a good old Far Side cartoon. So I like this one here because this illustrates the pilots. They've got their capacity, right? They've got their airplane. They are performing, right? They're up in the air, they're flying. They're doing it even as a team. And they've seemingly got this dashboard of controls in front of them, but with the caption and the image here, what you may be able to take away is they're about to fly into a mountain. And so they're not optimizing, they're not using their instruments and their data to really optimize their performance with the capacity that they have. And we have to do that in implementation and scale up. How do we do that? Well, there are a number of implementation outcomes Before program outcomes, we think about what are the outcomes of our implementation. Now, most folks are going to be pretty familiar with this one. This tends to be kind of the bedrock, the cornerstone of implementation outcomes, which is fidelity. And we do know it's pretty well established in implementation science that fidelity, and remember that means core component or essential element fidelity, not reading from the manual or script, does predict outcome. It's pretty well concluded. There are various types of fidelity though, and a lot of folks aren't aware of that. Adherence, quality, engagement of folks receiving the program or practice, and dosage are all different elements of fidelity. But beyond fidelity, there are a number of other implementation outcomes that can really help us think how we are doing, not just delivering with fidelity, but sometimes even with flexibility. Things like where a program is accessed, right? Or whether the program is feasible and appropriate to the needs of practitioners or to recipients. Those can help us adjust flexibility with the program. As well, paying attention to things like reach, particularly if we're looking for system-wide or community or population level outcomes. And cost and sustainability is also important to look at. And then lastly, of course, is where we were trying to go from the beginning of this presentation, which is desired population level outcomes or system or community outcomes. This is why we are here. What brings every one of us on this webinar today to this webinar. My guess is, yes, you are interested in implementation science and what we might have to say here, but only as long as it helps us all get to the outcomes we want for our children, for our students, for our families. And when we think about this, simply said, thinking about increases in indicators related to advantageous child and youth experiences and development, and decreases in indicators related to adverse child and youth experiences and development. And you can track that onto any system or type of outcome or sector of outcomes that you may need to or may be helpful. And of course, this all has to be sustained. It is not an event. It is a process of correction and multiple actions and decision making. So we're able to get feedback from each part of this theory of change to revise and improve what we're doing that will ultimately allow us to sustain each piece of this theory of change, from the partnerships to the capacity and performance to the types of outcomes that we're looking for. Does this actually matter? Well, yes, I will just offer a little bit of data, evaluation data from some work that we have done. We are doing a lot in North Carolina and even supporting some close partners in South Carolina in their efforts to scale the P positive parenting program. And we did a pretty robust and longitudinal evaluation of some of that work back in 2014 and 2015 in a couple of North Carolina counties. Well, what we found is if we looked at practitioner adherence, right? Remember, that's one type of fidelity, adherence to P session protocols. What was predicting that was the capacity and the performance at the service agency level. So whether or not those capacity elements, the particularly workforce development systems and the quality and outcome monitoring for improvement, the more that was in place in that site that was implementing, we saw a pretty good, not just significant, but moderate effect size for increasing fidelity. And remember, fidelity, we know, tends to predict outcomes. What was predicting whether or not that capacity and performance was there around workforce development and data and using it for improvement? It was the leadership and teaming structures in that same implementing site. So the more we had strong leadership and management support for implementation, the more likely that infrastructure was going to be there, that capacity was going to be there. So this, and that was a large effect size. It was really meaningful. So we do have evidence that putting these puzzle pieces into place can help us get to good implementation outcomes, which is going to help us get to good program outcomes and student, child, and family and community outcomes. Now, I took quite a bit of time to walk through that theory of change, and rest assured, I don't have a whole lot more before we get to our takeaways. But I hope that some of this has piqued your interest, has piqued your thinking and your consideration, and maybe you're looking for, where can I find some more? Well, I'll put up my last slide that has my contact information, and you're always welcome to look up the Impact Center or any other organization that does good implementation science and practice work, because there are more and more these days. And finding one that you can partner with that works for you in your neck of the woods is always a good thing. But this is a key report that may also be helpful for you and for your stakeholders. This report was put out in September of 2019, and it was a consensus committee that was formed around fostering mental, emotional, and behavioral development in children and youth. It looked at a wide array, and it set a national agenda for what was kind of articulated as almost the decade of the child, okay, at the national level, and what we could do to make that work. Well, one of the things that the committee did is it adopted and adapted this very theory of change that I just walked you through. This report was funded by the CDC and SAMHSA and NIH. And so as they were looking and trying to think through and bringing together a consensus committee around this, this theory of change was used to help think how this process could go in a national agenda. One box that the committee added here is this blue box, and it was implied in the one I showed you, but the committee, we wanted to make it much more explicit, which really gets at the intervention outcomes. And here you actually do see, if you're particularly interested in schools, school outcomes to foster child and youth mental, emotional, and behavioral development explicitly put into this theory of change. But as we all know, no one sector or entity owns children and families and communities. It's not just schools. Families, communities, and other sectors have to do their work as well. And so you see a variety of different mechanisms of change noted here. In particular for this audience, chapter 4 in this consensus study, and there is a link, I'll just go ahead and note, down there you see it. You can download a free PDF of the entire report or of just key chapters or sections. It's up to you. Chapter 4 goes through a review of strategies for educational settings. So that may be particularly relevant if you are working in school or educational settings as an administrator, policymaker, a clinician or a teacher, or you are here as a family, child, a student advocate, or are one yourself. That might be a great place to go look at the updated evidence. Part 3 of the report goes through implementation and scale up. And so if you find this type of talk and the theory of change energizing, interesting, it's making you think, well, you can read quite a bit more about it and the state of the science for implementation and scaling in this report. So feel free to navigate yourself to this link and download that report or any part of the report for more information. So I want to just get us now to takeaways and action steps. I've been talking for quite a while. We've had a little bit of interaction, but let's do more. We've got about 15 minutes left, which is great. Taylor is going to put into chat a link, okay? And what we want you to do is we want you to click on that link or copy that link and paste it into your internet browser. When you do that, what you will see is something that looks like this. This is a Jamboard. I have been introduced to this by my team and by our partners in our work. It's pretty cool. So some of you may be familiar now because this has been one of those neat little tools and widgets that's come along with a lot of remote work, but some of you may not. And what I want to tell you, if you're not, it's okay. I'll walk you through real quick what you do here. So you go to the link, and then over here on the left, hopefully you can see my cursor moving around. There's this little button right here that looks like a sticky note. And when you hover over it, it actually says sticky note. All right, I want you to click on that. It's going to pop up a sticky note box. So you can type your answer to the question above the slide and then hit save. And what is cool is that it puts a little Post-it note right there. And I will organize these. So what I want you to do is I just want you to share, pull up a Post-it note and type in some text, some answer, share one takeaway from today's presentation, one takeaway, or you can share an action step that you want to explore in your own work based on today's presentation. Put it on a Post-it note, type it in there. I'm going to give you plenty of time to do that. And while that's going on, so take your time. I'm going to prompt Taylor here. I know we may have been getting some questions along the way in this presentation, or if you have a question that you really want to ask, now is a great time to pop it into that Q&A, which I believe is in the bottom tray of your Zoom icons. And Taylor's going to read through some questions. And while you're watching or typing in your answers, I'll field some questions. So Taylor, take it away.
Absolutely. And it looks like we've got one individual that's on the phone that's got their hand raised. So if it's all right with you, Will, I'm going to see if technology will work alongside us. And I'm going to try and allow them to talk.
That sounds great.
All right. So I have allowed talk. So let's see here. Brooke, are you there? It always feels like you're calling to the great beyond. You know, you never quite know what's going to occur. All right. Well, it looks like if you are muted, then you can press *67. But just let me know and send me a message. It looks like right now, Will, that everyone is focused on their takeaways from this absolutely incredible presentation today. And if you would like to connect with those sticky notes, we'll give folks a minute to maybe conceptualize some of the questions that may have kind of come up for them throughout the presentation.
Excellent, excellent. Well, Taylor, I want to encourage you to break in if you do get a question. I'm going to just kind of chat through some of the sticky notes in the meantime. I'm glad to see somebody's interested in the National Academy's report, and particularly Chapter 4 that focuses on education settings. I see one here that is really good. I want to explore strategies for social media and networking within education. That's a great idea. So it's really interesting when we look at the literature around these types of strategies. There was a good review done, I believe in 2014, that came up with a couple of interesting points about it. The first thing, this was kind of related to doing public health communications and media strategies, right? So you think this is very similar to, when we're trying to do vaccine rollout, right? And trying to encourage everybody to go get vaccinated or wear your mask or social distance. It applies historically to other things like smoking cessation and child seatbelt use and stuff like that. Well, what they found when they reviewed the studies about these types of communications and networking efforts is, first off, they do work. They do work. But the effectiveness of them tends to increase when there are community-based sites where folks can go to get support, right? So you think about, for example, I've got 3 young kids. Obviously, we wanted to have good seatbelt use and car seat use, right? But I'm sure like many of you parents, you're like, oh my gosh, am I going to get this right? I know I need to do it. I know it's even the law in many cases. Boy, I'd feel great if I went and got support. Well, in my neck of the woods, you can go to your local fire station and they will teach you and even install your car seat for you. And that makes you feel great, right? You can think about it for smoking cessation, that if you have a clinic you can go to for whether that's something like Chantix or another medication plus behavioral support that goes along with that to help do behavior change, that can be even better. So having those media networking strategies is good, but you need to have the actual interventions and supports in place and accessible in your school building or in your community so folks can follow up. They can go there and get that. It also helps to have an effective policy or a good policy environment around that may incentivize or support or create a good environment for systems to do the work, not just put the social marketing strategies out. Let me pause there because I had a lot to say about that sticky note. I'm going to go through some other ones, but Taylor, I want to check with you first. Do we have any questions we want to get to?
So far, it looks like folks are connecting with everything pretty fluidly. I think that's a testament to your incredible translation of some very dynamic and complicated constructs. I did see another sticky note go up while you were chatting.
Absolutely. Let me hit some more of these. The blue one, incorporate resource into my research as a reference. That's great. We need more implementation research. That is absolutely the case. Let's see. Looking forward to reviewing the resources shared. Excellent, wonderful, and check out the resources. Like the capacity example with water, please don't just recycle it. You can be shameless, steal it, use it. We've actually found that metaphor to really resonate and really work. Something about having the pipes in the water just really seems to connect for a lot of people. I'm glad that it connected for you, and I'm hopeful that it will connect with those that you work with. So let's talk about this last point because I love it too. I'm glad that you're seeing implementation science and practice relevant to so many things that are happening. It is. And taking that approach, for me, the way I kind of think, what I think about when I read your sticky note is this conversation around equity and inclusion is really important. And it's really made all of us, I think, stop and think and evaluate and reflect about what we're doing in implementation practice when we're actually trying to do the system and the organization work. We could even think, hey, we could implement a really, really good evidence-based program, right? And it can be even implemented from a technical standpoint pretty well. Very competent practitioners or teachers, good support from leadership, maybe even some good data systems. But if that system is designed to get that water only to certain places or more to certain places than to other places, we could see a disparity in outcomes. And if that disparity in outcomes existed before, then good evidence-based intervention to those that are more privileged in that system, who may be more positioned to get the best benefits of that system, we may even increase the disparity. So really starting to pay attention to that, disaggregate our implementation outcomes, our program outcomes, and really involve our community members, those particular communities that have been historically marginalized or have not been in inequitable positions, to help us think through this. Because a lot of times, I'll speak for us, even we in implementation science, we might not be seeing all of the local factors, the system factors that may be at play. And so really having multiple lenses, which is what co-creation is all about, is really trying to understand what we're talking about and then strategizing around it, and then co-participating in our strategies to address it can really make a difference. And we've done some project work on that with that, and happy to follow up with anybody that's interested about it. Good. I'm glad you've got this other Post-it note. You've got a lot of implementation science elements, lots of fidelity monitoring. That's good. And remember too, there's a lot more than just fidelity when it comes to implementation. You can deliver an intervention with good fidelity, but to one student or to one family, and you're not going to get that reach you're looking for. Or if it doesn't sustain, or it's not feasible or acceptable, then it's not going to keep going, or it's not going to be adopted for very long. So keep looking at that variety of implementation outcomes as well. So Taylor, I know we've got about 5 minutes left. I want to check in with you on any final questions and any final housekeeping that we want to do.
So we do, before we move to housekeeping, we did get a question in the Q&A, and it's fantastic. And I imagine that this is going to be one of those that you'll be excited about as well. Do you have any other recommended resources for using implementation science in schools or potential additional trainings?
Yes, absolutely. I will, I realize I almost want to put it in the chat, which I'll do while we're doing housekeeping. But there are a couple of different resources at FPG. I will put in our website address, as well as our simulation lab address. And particularly for those interested in education, the SSBHC Center at FPG has quite a bit. They also have a simulation lab of sorts called the Active Implementation Hub that tailors content in particular for a lot of education settings. Our content right now is tailored a lot for public health and cross-community coalitions, scaling parenting support. So I'll put that other link in there too, and you can hopefully navigate to those and follow up with interested individuals in our team, with me through this contact information, or through the SSBHC Center if you're really interested in the education work. And I'll pop those into chat while we do housekeeping, Taylor.
Awesome. Well, Will, this has been phenomenal. As I said before, you are a master translator of incredibly complex constructs. It has been fantastic to sit on the other side of the computer and hear from you and listen to all that you and your team have done. And we're very grateful to have this resource. And reflecting on resources, we have a rich resource repository in the Behavioral Alliance of South Carolina's website. We would love to be able to add any additional resources that you would recommend, Will. So certainly the PDF from NAP, we would love to have on there and make it available to our Southeastern School Behavioral Health community members, as well as the community at large. We will certainly have 2 days webinar on our YouTube. Please subscribe to our YouTube. And that's the Southeastern School Behavioral Health community. Will's webinar will be on there, as well as archived on our website. A final piece of housekeeping for us today. I'm going to go ahead and put up that post survey. So this is the follow-up to your pre-survey. If you did not complete the pre-survey, that's totally fine. Please, we would love to just hear from you in this post-survey poll, so we can make sure that we are hitting the nail on the head, as I know we certainly did today. So I've gone ahead and turned that on. So if you could just put your responses in that poll, we would be very grateful for that. And as I shared at the beginning of our webinar, we are rapidly approaching the Southeastern School Behavioral Health Conference on April 15th and 16th, which is available to you all and to our community members, both live and virtual. Our live will be all CDC compliant. We have minimal numbers. We will be doing all of the appropriate social distancing, and we're very excited to offer that networking and educational opportunity and get us back to a little bit of a semblance of normalcy, especially with our vaccines coming on board. We're very excited about that. Registration is still open and will be open leading up until the conference. So we would love to see you there virtually or in person and continue this conversation. Again, we will make sure to share all relevant resources that Dr. Aldridge has been so wonderful to share with us today. And with that being said, I want to say thank you all for giving of your time and dedicating yourselves to this very important conversation. I know it was fantastic for us to be able to watch. And again, Will, this has been fantastic. And you are a wonderful human and a great asset and resource for our lab and for our community. And we are just immeasurably grateful and would love to have you back at any time. And hopefully you would be willing to do so. If any of y'all would like to make recommendations for webinars for our monthly content for BASC, please reach out to us at basc@mailbox.sc.edu or connect with us on our website at www.schoolbehavioralhealth.org/BASC. Or you can follow us on Facebook, Twitter, Instagram, YouTube. We are very 2021 around here, folks. We've got all the access and we want to create as much connectedness to resources and community as possible. So hit the nail on the head. It is 5 o'clock and time for some self-care. So thank you for completing our post survey. And again, Dr. Aldridge, thank you so much for being with us today. Everyone have a wonderful evening and a lovely weekend. Until next month. Bye now.
Thanks, everybody.